Good day. Welcome to Strong Ambition Podcast. Today we're going to have JC Rodriguez on the podcast, and he is an online trainer, actually more specifically an exercise physiologist, which is a specialized certification for those who can work with people within disease states and prescribe exercise, because you have to have specialized training for this. And that's his demographic that he works with. And it's going to be really interesting for him to tell a story, because he's going to tell you about what's really different about that and his specialized demographic that he really loves to work with, which is cancer patients. And it's a really cool episode because you get to hear his stories about working with these people. And he has some really amazing and incredible stories. And you'll learn a lot about human resiliency in this episode. So without further ado, here is JC Rodriguez. Good day, JC. Thank you so much for being here. How are you today, sir?
Doing well. Thank you so much for having me. It's a pleasure.
Oh, it's going to be a lot of fun here. So this is when we're formally meeting for the first time. So let's just dive into it, because I don't know too much about you, just a little bit. But why don't we tell the listeners more about you? Who are you? Where you're from? And how you got to do what you're doing now?
Yeah, that's a great question. So it's a pleasure to be here, once again. And so a little bit about me, I was actually born in Venezuela, and then I came to the States when I was young, kind of like around 7, right? And I was always like a skinny kid growing up. But when I came to the States, by the time I was around 12 or 13, I was actually kind of overweight or obese, kind of flirting with obesity, right? And then I wanted to get into sports, but I really struggled with my body weight, my image, right? And that also impacted a lot with where I'm at now. And I wanted to lose weight. I wanted to build on muscle, the average teenager stuff, right? And that's really what dove me into the more health and fitness field. But through that time of, struggling with my weight once I came to the States and having to lose it for sports, having to build up muscle, I worked through a lot of the different mental health issues, worked through a lot of the different challenges and barriers that comes with trying to lose fat, trying to put on muscle, and the challenges that come through that, And then once I got to college, I was coming into college with about 30 pounds of fat that I put on from dirty bulking. Around that time in my high school, right, the dirty bulk was like the big thing. And that's the advice I got. And I got to realize how bad the advice in the internet was, because that's really where all my health and fitness information was coming from. Once I got to college, I got my bachelor's in exercise science, and I started learning, okay, what's the science, what's the physiology behind things, started to apply that. I lost the 30 pounds. So between like 7 and 18, I lost, 20, 30 pounds. I gained it and then lost it again. And then I got into this field of working with individuals who wanted to really grow their health and their fitness, right? Because I saw how much I struggled with it just from the plethora of information that was out there that got me saying one thing, got me doing one thing, and then switching, going back and forth until I truly learned once I got to school and dove deep into the research. So it was a long-winded answer of, I went back and forth a lot with my health through different challenges, but it got me ultimately into working with a more clinical population and working with different individuals.
Well, yeah, that's a great story. It's going to be a long-winded answer, because it's a really cool thing when you come through your own fitness journey to help others, right? You don't just end up in it because you like sports and you like training. Like you actually had your own challenge, and that is a super interesting transition from coming from a different country, and then you move into an obesogenic environment, and then it just, whoa, hey, you put on weight. And so I'd love for you to go into a bit more detail on that. Like, what was the culture shift like coming from a different country like Venezuela and then coming into the States? Was it just that processed food was so available? Was there other habits tied into that allowed you to gain the weight? What was the big thing that you noticed?
Yeah, so I definitely noticed. So I'll go into the cultural aspect things first, and then I'll say the environmental aspect of things. So culturally, at least in the South American and Latin culture, not eating processed foods is something that's highly regarded. So I kind of come from a background of like not really eating sweets. Sweet tooth wasn't really a thing for me growing up. Processed foods weren't really huge on the radar either. We really tended to eat healthy, eat natural foods, and really prioritized, movement and eating healthy. But within that scope, and I think this is where a lot of people mess up, at least I think a lot of Latinos mess up, is that we will eat healthy but eat too much of it, right?
Mm.
And then we're like, well, I'm eating healthy. Why am I overweight? Why am I struggling with my weight? I eat healthy, right? So that's really where I fell into, right? And then in high school, I would see people like eating potato chips, pies, and then be ripped and swollen. I was like, what in the world's going on? Um, so I think environmentally, it is the aspect of, having so much food available to you, and kind of that obesogenic environment that you're in, right? But also, it's culturally, it wasn't connecting for me. I didn't know why I was struggling with it when I was just like, I'm eating healthy. Why am I overweight?
It's so important for people to appreciate that because this is why the calories matter. This is why it's super important to worry about quantity. And I've had some people try to say this sentiment before. It's like no one ever gained weight eating whole foods. I'm like, yeah, it's a lie. Like that's just like when you say no one ever, it's already setting you up for a chance someone's done it. And on top of that, you're gonna say no one's ever gained weight from eating whole foods. Like people can overeat anything. And I see a lot, like I know a lot of people who just you look at, oh, these are the foods you're eating, well then you're simply just eating too much of them. And it can definitely happen because things that like fruits and vegetables, but especially fruits, people who do have sweet tooth, you can still overeat fruit. It's difficult for most people, but it's still very doable, especially when you come from a place like Venezuela. I imagine there's some much more homegrown food and fruits and tropical fruit, and so you would get just better tasting food in general. But I think that's really interesting. So as you got into more of the health and wellness and you had your trials and tribulations, what were some of the big challenges that you had to overcome for yourself when you're in this new path of trying to improve your health and fitness?
Yeah, I think the biggest challenge I had that really set number one my career, but also made me look internally was I was in my first, I think, exercise science class, and the professor put up a list of all the benefits of exercise from improving bone mineral density, blood pressure, weight, muscle mass, right? Glucose control, so many benefits of exercise. And I was in the middle of the class thinking, those are all the benefits of exercise. And I'm over here worried about benching 225 and getting abs. Right.
Yeah.
And it was this like smack in the face to me of like, what am I doing? And I'm not saying there's anything wrong with that,
Yeah.
but it's just like almost like reality kind of hit me a little bit, you know? And that was really the moment of like, am I almost focusing a little bit too much on something that doesn't matter as much? Because I could get away with it, right? I was 20, 18, 18, 20 years old. I could kind of get away with, focusing on those things. And once again, it's not to say that any of those is bad, or any of those is bad at all, but it is to say, what is my long-term focus at? If we see this natural disease occurring, this natural deterioration of life, right, into a disease state over time, and I'm focused on these other variables that may be helpful, may not be, right? What's my long-term perspective? Where am I trying to end up, when I'm 80? And that's something that I really learned. And as I worked more with people, I started becoming maybe more focused on functional movements, more focused on measurements that are better for health, for long-term health and longevity. Right now there's a VO2 movement, right, that's kind of focusing on emphasizing VO2, but that is one of the variables of longevity. Muscular strength, muscle mass, right? Which those are important, but it's always like, okay, how's my blood pressure? How's my blood sugar? How's my cholesterol? You can be young and still struggle with these things. So I kind of became more in tune to the medical and clinical side and helped me reflect on myself and my goals through that. And I realized maybe I wasn't as healthy as I wanted to be just because I was kind of skinny or lean, right? When you actually measure these concrete health and fitness measurements.
It's a beautiful perspective to have. How old were you when you started to realize that?
I think 19.
That's huge because, for someone at 19 years old to realize that there's more to life, like there's a lot of life left to live that you have to concern yourself with. And to realize that bench pressing isn't the most important thing is a huge, huge maturity stage to have, right? Why fitness really matters. One of the things I always tell people when I'm working with anyone that's in their 40s and up, it's like, you really don't want to fall the rest of your life. Like you really want to be able to handle fall the rest of your life because that is definitely something that could kill you when you're older. And it doesn't kill you on the fall. It's like once you're like a senior, like above 65, roughly like an older population, if you break your hip, I didn't realize that's like a death sentence, because if you break your hip, the mortality rate after that within the next 5 to 10 years is like 80 to 90%, because you
Yeah.
can't use your hip, you can't move, you can't go to the bathroom, you can't take care of yourself. And the simple act of slipping and falling is a death sentence, because you do not have the physical capacity to handle a fall. It's like, it's not a question of if you're going to fall, but it's like, can you handle it? And, you know, my dad's been very lucky that it hasn't been worse. He's a farmer. Now he's in his 60s, and he's one fall away from that actually being totally, well, career ending for him as a farmer. And so that's what I always educate people on. It's like, these things matter a lot more than just the aesthetics, for sure. And you had this really good phrase that I've heard some people kind of look at it that way, but aging in general is progressively going into a disease state. And I think that's just a well articulated way of saying it. And I haven't heard it that way. Inevitably, you're going into a slow disease state. Like, everything slows down, everything becomes a little bit more atrophied. This is a slow disease in some sense. And it's like, we can pretend when we're 18, 19, 20 that it's not going to happen because you haven't peaked, so to speak, but at the same time, it's going to happen. So I think that's a really mature and smart way to look at it. When you look at your evolution from there, what were some other really big points for you, is whether it's training or nutrition, that helped you really curve your whole lifestyle?
Yeah, I think the biggest thing that stands out to me is my first personal training client. And that was the first encounter where I almost saw like class and real life like just clash together. And what I mean by that, as I was training, she was my first client. She was 62 years old, never worked out a day in her life. She was scared to get started exercising. She would label it as like she had a moment of courage of sending the send button via an email. That's all she did. She's like, I just pressed the send button. I was like, whatever happens, happens, right? And she was just so excited. She was nervous at the time, but that's how she would explain it now. She had that moment of courage of asking for a trainer, and I was working with her. She just wanted to improve her blood pressure, be healthy, lose weight, be independent throughout life, because she was able to see how her parents' health deteriorated, were in nursing homes, and she didn't want that for herself. She had a very challenging time with that. And she worked out just twice a week, 6 a.m. before work. Did about 30 to 45 minutes of a workout, right? And within a year of consistency, she was doing full blown push ups, right? Like, that is not, she was not like doing knee push ups. She was doing about 12 to 15 full blown push ups. That was one of her goals because it evolved over time. Her next goal was to do like a full pull up. And I was able to see all the benefits of that my professor put up on the board, the improving bone health, improving muscle mass, improving strength, body image, uh, mental health, right? I was able to see all those benefits in her as her fitness improved, because she still did, her medical checkups. So I was able to see, her blood pressure improve. I was able to see her blood sugar improve, her cholesterol improve. So as I see her fitness improve, I'm starting to see all these measures starts to go down. She loses 30 pounds. And in that moment, I realized, like, this is what I want to do. I want to help people achieve a better quality of life. Those who are really in a healthy way, desperately looking to improve themselves.
Such a beautiful moment. I know that very well. And I had a similar one. That's actually what got me into training before I was even intentionally training. I was just showing a friend what I did for a workout, right? And then you have that moment where you look at them and you're like, this is a different human. You've completely changed the human that they were. And that's a beautiful sight. That's a real impactful thing that you've had in someone's life. When you talk about rewarding, it doesn't get much more rewarding than that. And especially when you talk about people in more of the gen pop. And I had one of my first boxing coaches tell me this, because you get really excited for the idea of athletes, right? It's like, oh, helping an athlete win something, and training athletes sounds badass, Rocky movies, all that jazz. But then he talked about how it's the gen pop people, the people who don't really need to be there, the people who actually just struggle but are happy to get simple things done. They're actually going to be the most dedicated. They're going to listen to you the most. They're going to appreciate you the most. They're the ones that you are really going to show up for way more often as it goes on. And I think it's still true to this day. Those are my favorite people. It's the people who it's not easy for. I love helping and supporting them most. So I think that's a really beautiful story. So as you transition into more of the training world, I'm curious, what were some other really big concepts that you learned along the way within your career of being a trainer that you think would be really helpful for people to appreciate that they might not really necessarily know when it comes to training or nutrition?
Mhm. Yeah, I think there's two sides of that coin, right? So I'll try to hit both of them, right? So I started training, kind of like apparently healthy individuals, and I wanted to help people with their health, improving blood pressure, blood sugar, body fat, muscle mass, right? And then that slowly transitioned into seeing the benefits of how exercise works in a disease state. So I was learning on how high intensity interval training can help with people with heart failure, right? And it helps improve their cardiac condition. I was able to see how it helps with diabetes, pulmonary disease, how it helps with COPD, improve oxygen efficiency. So I dove deeper into the clinical side. And I think the one thing that I learned that helps both, from a prevention and let's say a disease management or a disease regression state is twofold. Number one, exercise does help prevent it, right? But in the case where you still exercise and luck of the draw, you end up still getting a disease, whether it's heart disease, heart failure, heart attack, cancer, diabetes, your health is still dramatically better than somebody who never exercised and still had a heart attack, a stroke, or whatever it may be. And you see it night and day. I mean, the patients who worked out before, whether it's a heart attack, cancer, whatever it may be, compared to those who never did, surgery goes smoother. They recover faster. They spend less time in the hospital. Um, they have less symptoms and side effects. It's a drastic different night and day. So I've heard some people say like, well, it doesn't prevent it all the way. That's true. I mean, you're much better doing it than not doing it. But even if you do, you're still much better than someone who never exercised. So I think that's important to know. I think that's the big takeaway that I've learned from kind of being on both sides, maybe a little bit.
Right. It's building a resiliency to life. I always try to explain that to people, especially I love that you talk about the high intensity interval cardio, the high intensity cardio, because whenever people are doing hard cardio as they used to run a boot camp, they'd be like, oh, this, I'm going to die or this is killing me. And it's like, no, the whole idea is it almost does. And when you really think about what high intensity interval cardio is, you're at your heart rate max or near it. Like you're literally trying to achieve your maximal effort. And what I think even gets missed with more of the, I want to say commercialized and the kind of bastardized forms of hit cardio, because it's not hard enough. It's too short a rest for it to even get you to that high max, right? A lot of people do like kind of a 30 on, 30 off, which is, hey, it's a cardio workout. It's not the end of the world. But when people don't go hard enough for it to be a true hit, when you make a good workout, people should feel like it's so intense. And then after it's done, you're like, whoa, what a rush. It was an adrenaline rush. It was a complete adrenaline rush. And so I always tell people, it's like, yeah, it's near death. But if you keep pushing yourself and training yourself near death, it's going to be hard to kill you. Right. And that's literally how you develop that resiliency towards these things. I love hearing how you transitioned into working with more of these special, cases with disease states. So I'm assuming when you went to do your degree, you got a full exercise physiology degree. Is that correct?
So I did my bachelor's in exercise science, and then I got my master's in clinical exercise physiology. Yeah.
Yeah, yeah, and I was like, there was a certification to do it here. Ended up not getting it because I was more interested in working with more of the athletic population, and a full exercise physiologist is to work with more of the clinical. But it is essentially what I always tell people, like that's an exercise doctor, right? It's like who doctors would refer to, and you're insured and you're able to work with any population, and so I think that's really cool. So tell me how you really enjoyed that transition. What made you want to transition all the way into the clinical setting?
Yeah, kind of like I said earlier, it started with learning all these different measurements that the doctor looks at and improving them. But what really made the shift is I didn't really know who I wanted to work with, whether it was athletes, just general people, geriatrics, pediatrics. I didn't really have any idea. So I kind of took that, Gary V method where he's like, try it all, And so that's what I did. We had a cardiac rehab volunteering group, and I volunteered in cardiac rehab, and then we also saw stroke patients and a couple cancer survivors as well. And I absolutely loved it. I built great relationships. We had diabetes prevention, worked with diabetes patients with diabetes as well. And I really felt in love with that field, mostly because I almost got to be work alongside with them in their health, where it makes a deeper impact, right, of their long-term health, right? So if you get, for example, somebody gets diabetes, that cuts easily 5 to 10 years off your life, right? But if you start exercising, that slowly starts to increase, right? So that was kind of the start to it. And once I got into the program, the clinical exercise physiology program, it's very cardiac and pulmonary heavy, a little bit of cancer. And I did cardiac and pulmonary rehab. And I did that for about a year or so working in the hospital, but I almost didn't have that same passion. And that just kind of felt weird to me because it's like, this is exactly where I want to be, but I don't know what's going on. I don't have that same maybe satisfaction as I did before. So I was like, well, maybe I still need to dive deeper into like, what are the cases or the different patients I've worked with that really drove me to my point of overwhelming passion. And when I look at that, I think of the patients who had almost like this innate healthy desperation to improve themselves, whether it was a stroke patient, whether it was heart failure or cancer. What really drove me to my biggest point of passion is helping those who really wanted to make a difference. And I took a kind of step back and I saw cardiac rehab, and I think it's great, by the way. I think cardiac rehab is incredible. It can change people's lives. But there was almost this overwhelming feeling of patients kind of doing this because their doctor told them to, which is still good. Doing this to get back to work, which is still good and important. Doing this to get back to normal without realizing that their normal is what got them there in the first place, rather than this innate desire to be better than they were before. So that way they don't end up in the same spot. And I saw that very deeply within the cancer survivorship community, right? There was this overwhelming desire to be better than before. And that's really what drew me to oncology rehab, is trying to help them really feel better, improve their health, improve muscle mass, because that increases survival drastically. Strength, right? Even learning about the benefits of exercise through treatment and seeing how exercise and movement can help reduce different side effects, that just grew a burning fire in me and just kind of flamed or fed the flames, right? And that's kind of how I got into it a little bit.
That makes a lot of sense. As soon as you were talking about how the cardiac patients didn't have the same fire. And I mean, I'm going to use the case in point of my dad, where he is like a candidate for a heart attack. And even then, when people have heart attacks, like how often do they have many? And
Mhm.
it's like sometimes they have the one where they're like, okay, I got to smarten up. But as you just mentioned, they just kind of want to get back to normal, and their normal was the problem. And even if people know, it's like, yeah, my lifestyle is probably going to lead to a heart attack. They don't change. Like they're so aware. It doesn't, it's almost like, it's like smoking, but you just don't smell. It's like people don't see that you're doing all the same behaviors. I think one of the major things about smoking cigarettes that made it such a stigma is it costs a lot of money, and there's a stigma of seeing you doing it. But you're behaving in a very similar way as someone who's smoking, because you're doing all the habits. They're just socially acceptable habits, and it's going to lead to an earlier death, right? So you can see that, like when it's someone who receives cancer, though, I would imagine that it's so random, right? Because yes, you can have habits that make it more likely, like smoking, to have cancer, but a great deal, I imagine, of your patients don't have inherent habits. It's kind of the randomization of cancer. And so when you finally have this thing, you hear the most incredible stories of courage, and just, it's me versus this thing. And you have to have that resiliency. When it's you versus your previous lifestyle, it's kind of a hard thing to give up. It's a hard thing to see it as. So I think that's really beautiful. I would love to know give me some examples of what's really different with working with a patient. And I know there's a spectrum. I can only imagine with cancer patients, what's inherently different about how you work with these clients that, from say Gen Pop, what kind of parameters do you have to have in place?
Yeah. So once again, it is a huge spectrum, right? Because within cancer, I'll be the first to tell you, your oncologist doesn't know everything, right? And that can be kind of hard to kind of swallow a little bit. But you have, your oncologist, you have your radiation oncologist, you have your surgical oncologist. Well, in exercise, you only have the clinical exercise physiologist, right? So it's like I need to know everything from everyone, from brain cancer to breast to prostate to leukemia to lymphoma to pediatrics, right? And all the different forms of treatment. So all of that is really taken into consideration. Um, to make it at least simple for me, I like to split it up during treatment and after treatment, right? So during treatment, I think it's important to really be mindful of what treatment and side effects. So I'll kind of break them down into the large groups. So if it's chemo or radiation, cardiotoxicity is a lot higher. So it does kill the cancer, but your risk of heart disease or cancer are much greater. So we're really trying to focus in on kind of that cardiovascular system, getting that endurance up, right? And through that time, that's from a scientific perspective, but through that time as a trainer, I'm really trying to focus on getting in as much movement as they can. So I like to explain it as a firefighter. When you're on call, you're working hard, right? But then you also get maybe more days of rest than other people, right? So what I mean by that is when chemo fatigue hits, take that time just to be active, whatever your body can give you. When you feel great, take advantage of it and go hard. You know, don't be scared of really training on those days and working hard on those days because you want to take advantage of that time. So that's kind of during treatment. Out of treatments, let's say out of chemo or radiation, it does look a little bit different because of the different treatments and medications for it. But that's really the time I'd like to focus on rebuilding to thrive. You're not rebuilding to do what you did before. You're rebuilding to thrive, to reduce the risk of heart disease, to reduce the risk of cancer, to improve your muscle mass because a lot of muscle mass is gone. Hip flexors are very weak. Glutes are very weak because being on a chemo chair, right? Shoulder pain, tension. So we'll focus on mobility and kind of flexibility a lot at first, just because a lot of stiffness and fibrosis can happen after radiation and surgery to kind of prepare them and get their mobility going for more strength training and maybe a stronger stimulus approach.
That makes sense. I really like the idea that you give there. Use the energy when you have it. I think more people in general, a healthy population has to be using that. But I think it makes sense to have the endurance when you're in, say, a treatment phase. Is it contraindicated to do strength training or is it just minimized at that point?
Great question. Realistically, there isn't a hard stop or guideline per se in terms of don't do resistance training. The only time it's really adverse is right after surgery until you're cleared. Then the recommendation is start slowly. You get the 6 to 15 reps ranges, anywhere between 60 to 80% of like kind of 1 rep max type thing. So it's kind of almost normal. The biggest thing I would say is it can be very uncomfortable working with your body after surgery. So I'll give an example. After any GYN or any surgery to the abdomen, think colon cancer, GYN cancers, maybe prostates in some examples, it can be uncomfortable to walk. So walking and doing lower body exercises might feel weird. So kind of getting used to that, going through the motions first before you actually start pushing yourself is important, right? Same thing with breast cancer. It only becomes a limitation when you have an expander. So that's like if they want to do an implant or something like that. But when it comes to, for example, lifting in general, it's actually good, it's actually healthy, and it can help prevent a lot of different side effects from the treatment. So any pain, stiffness, lymphedema, which is kind of like swelling. So it's actually very helpful and recommended, even during treatment.
Yeah, no, and that's great. And I think that's one of the things I think everyone just needs to appreciate that even if you have cancer, you're supposed to be doing this stuff. It's like, it's no matter what, it's going to be helpful. Is there like because you said endurance is really important in that phase. I would just be curious, do you just go look for a balanced approach of like cardio and strength, or do you, as you had mentioned, you kind of want the energy, so you kind of focus a little bit more on endurance? Like, I was just curious of what your split, not full on split, but how much more you focus the aerobic system versus the strength training system when, say, they're pre-treatment or post-treatment?
Yeah, great question. It really depends on the individual. I try to balance it out as much as I can, doing, certain days cardio, certain days lifting. And what I've learned is everyone can handle different amounts. Everyone has
Yeah.
different, let's say, mental attitude. I had a patient one time who she was adamant on working out 7 days a week. Doesn't matter what she felt, she was going in there working out. I had to cut her back on a lot of things. I was like, I need you to just rest and recover right now. And I almost had to fight her on it too. Whereas others, it's like, can we do a 10-minute walk? So I really try to get a balanced approach on both. I think, let's say on the lowest, let's say on the greatest entry point per se, I want to do a 30-minute at least workout, right?
Mm-hmm.
And I want to get some full body motion going. This is during treatment. So we're doing squats, rows, presses, and like a push up, right? And then right after that, going into cardio or vice versa, depending on how they're feeling, or the strengthening one day and then the cardio the next day. It really depends on their schedule, how they're feeling, and so many different factors. But that's kind of how I like to split it up, just as an entry point to lifting and feeling comfortable with emotions. Um, After treatment, I'm really looking for, can we do 30 minutes a day of walking, right? Of a brisk walk. That's going to challenge, I'd say, 90% of people, even healthy population, really.
Yeah.
Um, so can we do that 30 minutes working up to 5 days a week? And we're looking at 2 to 3 days of strength training. So it's almost pretty similar to most people, right? But it really depends on where they're at with their fitness. If they worked out before, I had a patient who within 3 to 4 months, we were able to work her into getting back into CrossFit, and that was her goal. She's like, I just want to get back into CrossFit, and she started doing CrossFit, and then we met once a month, or maybe twice a month or so. I don't remember exactly. But then her goal was to get to do a handstand push-up. And I was like, you just had breast cancer surgery about a year ago. And she's like, that's my goal. And I was like, let's do it,
Yeah.
And she was able to. So it really depends. Everyone's different. There are incredible stories from working with a gymnast and being able to do a handstand, getting back into CrossFit. Somebody wanted to bench 225 again, and or just be healthy and move and have no pain. And or even patients who want to sleep better. I've had patients who's like, I have cramps that wake me up in the middle of the night, and that's their greatest accomplishment through working, and doing different exercises. So there's so much the body can do.
Yeah, I think you've probably seen some of the most incredible stories. It goes back to some of the most regular people have the most incredible things. And I imagine going through watching all these cancer patients have to confront that. That's where they're really tested the most. And I think it's very valuable for people to appreciate that spectrum of the recovery phase, because, you do everything you can to prepare them for this battle they're going through. It's training for a battle, essentially, right? In which case it's going to completely, rock their system to a toxic point, because that's the whole idea of the treatment. And then you're coming back from this impact. It's like starting fresh, right? And everyone needs to appreciate the most important form of movement is walking. Like, so even if you're not coming from there, you're coming from zero to something, it's always walking. The most fundamental movement other than breathing is walking. It's like you first, it was breathing, it was crawling, it was walking. And you just said, like, a brisk walk for the average American for sure is a big deal now. And when people are worried about getting in shape in the perfect workouts, like, go for brisk walks more often, and you're going to realize like how effective that simple training is without really, affecting your joints in a negative way. And that's what it kind of like frustrates me when people are like, oh, I'm going to go for a jog. It's like, no. That's not sustainable for you right now. Let's start with a brisk walk. Like, if you can do that for months straight and then you build into the strength training and all the other things, I think it's great to hear. Now, I want to come back to the stories, because I'm willing to bet you got a bunch. Inspiring stories. Like, I would love to hear, especially from like a learning perspective. What are some of the coolest stories that you have that really taught you a lot from your experience with this kind of clientele?
Yeah, I think two stories really stand out that are some of my favorite, that really helped me grow and learn a lot in terms of something that I've never experienced and helping other people work through, right? So I had a 68-year-old cancer survivor with lymphoma, and he kind of exercised. He did his thing. He wasn't overweight. He was slender. He was pretty tall. and we're talking. He was a lawyer, and so very smart, very well read, exercised pretty frequently. And he's like, well, I exercise, I kind of do a little bit of weight training, I do a little bit of cardio, but I really want to improve my health. And we went over his plan, and I was like, okay, so this is what we need to start focusing on. I met with him, once a week or so. We started doing some more strength training. And by the end of, let's say, 3 weeks, he comes back to me. He says, when I first left cancer treatment, I thought, I'm done. I want to leave this behind. I don't ever want to think about it again. But the more I work with you, the more I realize, the more I can engage with my past experience, the more I can actually grow and get better. So he's like, I've grown in terms of strength. He's like, I've nearly doubled my strength in 3 weeks of working with you. And this would have never happened if I would have never realized, like, hey, something big or dramatic kind of happened to my body. I need to push myself more to overcome it. I can't just keep doing these 2 to 3 pound weights and pretend I'm going to be just fine. You know, I really need to push myself because cancer is the disease of the cell. So I need to make the cells work harder. And that little kind of tidbit changed his perspective of like, oh, I need to work harder to fight the disease and really get stronger and feel better. So I think that's one thing, that the more you engage with it, the more you kind of overcome it as well.
That's
So
really
that's a
cool.
small example of maybe mindset. I'll give another example, and then I'll kind of get into some different ones. But there's a patient I was working with. He was male as well, and I could not get him to be motivated about anything. He's like, yeah, I want to work out, but I'm just trying it out. My doctor told me to be here, and that was, I think, 40%, maybe 30 to 40% of patients I think were motivated. He just really was there because his doctor said something. He's like, I'll try it out. I move. And I couldn't really get his maybe trigger point to get moving. And he kept mentioning his blood, his immunity was low, his immunity was low, his immunity was low. So I told him, I was like, well, one of the benefits of exercise is that it can actually boost your immunity. And he just kind of paused and looked at me and then said, so it can boost my immunity? I was like, yeah, it's one of the benefits that we see from moderate intensity. We want to stay away from high intensity, but some moderate intensity could actually help. We see that it does help. And he's like, so I can see my grandkids again? And it never registered to me. I mean, it has before, but with this patient, it's just like, that's what he was missing. He was missing that ability to connect with his grandkids, with people. He had to stay away. Right. So in that moment, I realized, oh my gosh, this is what's helpful for him. This is what's meaningful to him. And then he started moving and exercising to reach a goal that goes beyond just him. Right. And he was able to, once again, double his strength, move, get up and off the chair a lot faster, a lot quicker. I mean, the person who came in was very different than the person who walked out. Right. You almost saw a smile on his face. He was excited to come in, which is not a very typical story. Most people who come in, they're not happy. They're not excited to be in the hospital. But you see nurses seeing this patient walking around with a smile on his face, like, I'm going to go, train, right? So it makes an impact on patients' lives, on clients' lives, right? Um, yeah. And then in terms of, I think, strength and seeing just, drastic change in terms of what somebody can accomplish. It was a breast cancer survivor who was her third time getting breast cancer. So it can come back. And the first time she kind of went through treatment, didn't change anything. The second time she didn't finish treatment, so it came back a third time. And this time her goal was to do things kind of the right way. She wanted to focus on her nutrition as well, focus on strength. Focus on avoiding certain foods or avoiding certain meals, and really dove deeper into that. And we worked, I think, for about a year or so. And she's the one with probably the strongest mental toughness I've ever seen, who really inspired me. And I was like, I need to do better. Like, like I'm slacking, and she probably did, let's say, in a week, maybe 250 to 300 minutes of exercise. In a week, she probably did 75 miles biking.
Wow.
Uh, you know, she was able to do full blown push ups, a plank, which is all after 3 surgeries on the chest. That's huge. That's unbelievable, right?
Hmm.
Uh, so she got to see tremendous health benefits. She was able to travel freely. She was able to move around, pick up her grandkids. She didn't have any issues, right? Because of all the work that she put in, even after three or 2 recurrences of cancer. So
That's incredible. Yeah, you're going to see some of the most resilient people because nothing tests you more than death, right? Like it's as evident as you can get, and to have some of those transitions are really cool. Where you mentioned it starts simple, like the one individual you had said, the guy who just didn't realize why it mattered,
mhm.
and for him to just all of a sudden, oh, this stuff does matter, and that's important for everyone. Everyone just doesn't really put their why in front of them often enough. It's like your why has to be like tangible, has to be right there. And when you have that right there moment, and that's actually an example I give a lot of people. I say, take your worst habit you have right now. And let's say we had a computer that could determine that that one habit is preventing you from going to your grandkids' graduation because you died prematurely. I think you would second guess your habit a little bit. But if I just told you you might not live another 5 years, that's actually not a big deal to you. But because I said that you might not see your grandkids, that's a big deal to you. And so to make it a tangible, real felt experience. But I love hearing all those. I think I love hearing these transitions. I totally understand why you got into what you're doing. But you also do some online training as well.
yeah, so I really saw how much exercise was impacting people's lives, and I transitioned completely all online. So that was my biggest opportunity for helping more people. And I really wanted to impact more lives across the globe, right? And that's so important because if you work in a facility, you're only able to help people in that facility, you know?
Right.
Only those who have access to it, who can pay for it, who are close by, who are part of the membership or whatever it might be, But I really wanted to make this more attainable for anybody at anywhere, right? And the reality is that exercise oncology is something that, number one, very few hospitals have in general, and very few people have access to it. Very few oncologists know about it. Very few oncologists have referrals to it. And I really wanted to make this accessible to anyone, right? I have clients I work with from Colombia, from Venezuela, Indiana, New York, um, which otherwise they wouldn't have access to it, right? So yes, I transitioned completely all online, and once again, you're able to see tremendous benefits from 20 to 30 pounds of fat loss to doubling your weight, improving mental health, improving body image. That's something that's not talked about. Getting back to living life the way you want it to, whether that's traveling, hiking, running with your kids, going kayaking with the family, right? Those are activities that you kind of miss out a lot, or that you do miss out a lot, and training can make a huge difference in all that.
That's really awesome to be able to still work with this client specificity through online training that you might not think, as it sounds like clinical, you should be in a clinical setting. And how long have you now been in the online space?
I think for about 6 months now, or maybe seven or 6 or 7 months. Well,
What
for myself, yeah.
Yeah, and what difference do you see from helping individuals one on one, from being in person to being online? Both pros and cons of it.
Yeah, I think the pro of online is, number one, the access and the feasibility of it. Online training, number one, it's going to be cheaper in many regards than personal training. That's
Mhm.
just a matter of fact, right? But it's also more convenient when you have kids, when you have a schedule, when you have a treatment schedule, when you have doctor's appointments, when you have a family, when you have a work, and you have the financial burden of cancer. You know, the affordability of it matters, but also the access to when you need care. So the huge benefit of being online is just that you have access, right? You have access to the person you're working with. Do you have a question about nutrition? You can ask that. If you have a question about your exercise, you can ask that. Something's bothering you. All that accessibility makes a huge difference that a doctor cannot give you. If you have an issue, you either send the message to the nurse, and then the doctor's going to get back to you when he can, or you got to schedule an appointment out for about a year in advance, right? The accessibility that's online, it's unmatched. That, I can help many patients in any moment of the time. So I think that's huge, number one, in terms of benefit, also working with their schedule as well. I think in person, many times going through cancer treatment can be very lonely. And having that in person interaction makes a world of a difference. So that, I think that's the one thing that I think makes is huge. I worked alongside massage therapist and art therapist, and something that a massage therapist once told me, she's like, the patients that I work with, they're so used to not having physical touch that even just a massage is just life changing for them, right? So being there with somebody and helping them stretch, like in person, makes a huge difference, you know. Because sometimes it could be like, oh, cancer, is that contagious? Like you kind of step away and you have all these maybe
Yeah.
unconscious thoughts um, that the other person feels, even if it's not said. So I think that's one of the benefits of in person. But online, I think just provides patients something, clients something that is unmatched by the medical field, because most hospitals don't have it, and you don't have that access to it either.
Absolutely. It's the access for sure that I think people underestimate. The difference between a in-person trainer and an online is like that access. You can maybe text your personal trainer, but it's just not the same picture. And the access is what makes it convenient, as all you said, and all the affordability. And you end up having the conversations that they need to within their real life. It's more lifestyle integrated, right? Whereas the personal training is time for money a lot of the times. Like you're here at this place, I'm here at this place. Now that makes it, as you mentioned, the in-person, the personability part there is super valuable for people. But I actually got frustrated because a lot of the people that see me in person weren't doing the other stuff, right? They're not doing the stuff at home because they just like, they're happy that they have someone that holds them accountable. Because, hey, if you show up, then I'll show up. It's like, well, you need to show up for yourself too. It can't
Right.
just be because we have this time and date. It has to be because you're going to go cook your food because you're supposed to. You got to go do your workout because you're supposed to. And that's what the online training kind of gets people integrated into their own discipline, but it gives them a blueprint to do so. And that's what makes it so valuable. I'd be really curious from your perspective as you're in the online space. So a big part of the online trainer's job is social media. And social media, that's their marketing. That's a huge part of how you connect with more people. And I'd be curious from your perspective, because you definitely see it with regular training and nutrition information. But do you have to battle any other kind of odd noise out there when it comes to nutrition and training, to your target audience, more in the cancer kind of population?
Yeah, it's frustrating, but it's also really kind of sad, because it's almost like a cancer diagnosis almost makes you susceptible to everyone at any time, because that life-changing event leads to desperation and then leads to other outcomes that people are willing to have greed and grab at. So a lot of people are like, try this herb and cure cancer, this diet cure cancer, alkaline diet, so many different blood type diet to cure cancer, don't do this treatment. And I think when you're playing with somebody's life, that's very hard. That's that it brings a sense of sadness and anger at the same time in me to see that. um, that is not to say I think making the decision to go through treatment is the hardest decision somebody can make in their life. I would never say um, you should or you shouldn't. I would advise to do it, but I would never sell somebody on not doing it. That makes sense. And I can respect somebody's decision not to do it. But seeing that targeted advice in terms of don't do treatment, try natural, I think that's very misleading. That's very hurtful. That's very harmful to the individual, because it's their life. That's totally different um, advice there. So I think that's something that's really hard. So to narrow it down to a couple of things, I think alkaline diet, it's something that's recommended a lot, whether that's books, and then people will sell pills and things like that. Different um, advice in terms of herbal and supplements, which can be very hurtful and harmful. So different supplements can actually interact with chemotherapy, which that would not be good for the individual. It could actually lower your your chances of survival. So I think that's one of the most common, more so in the nutrition and, let's say, alternative therapy based than the exercise. But I think when it comes to the exercise, there is this huge push for light intensity yoga, tai chi, that almost makes you feel safe and comfortable, of like, I'm doing some exercise and movements, but I'm not really forcing myself to change, which is good, has a space, but your body needs more than that, you know? And I'm glad that more and more research showing that you do need that intensity, that higher intensity exercise. So yeah, to make it shorter, I guess, from an exercise perspective, is the lack of intensity, right? And this almost numbing down of just movement and feeling good, which is still good, but we need more than that. And then from the nutrition space, I think more of this curative foods that don't really cure cancer.
Yeah, that's such a dangerous thing. I already see that a lot of the nutrition and training information it can be inherently dangerous, but it's not to within the next 3 to 5 years of their life they could die. You know, it's like if someone does a vegan or a carnivore diet, I don't think they're going to die within the next 5 to 10 years due to that life choice. They're going to start to realize whether or not it works pretty quick, and you know, they're betting some time on that, and more than likely they're not going to sustain that extreme of a diet. And whereas, I mean, you get into, I think you could argue within like fasting really borderlines on anorexia. So that's where you get to really dicey. But when you're talking about cancer, that's for sure playing with someone's life. And unless you have some substantial evidence for this, that is completely unethical. And so I imagine that the when what I kind of battle with, similar to yourself, and you still battle some of the nutrition information out there, but what you have these people targeting your people, right? Really targeting that, and they're so vulnerable. So I can imagine that's both saddening and anger. So that's got to be tough, but it's a good thing that you're out there. It's a good thing that you're getting this message out there and you're helping the people that you do. I think it's incredible. I would love to know, as this is the Strong Ambition podcast, what is your most recent ambition? What's something that you're really excited coming down the pipeline that you're working towards?
Yeah, so right now I really want to impact the amount of people I am able to help, you know? And I'd love to see just more countries, more states being able to kind of see a global impact, rather than that localized that only a facility can give, right? And I think that's the biggest thing where I'm really looking to see how I can help different people in different countries, whether it's, you know, Venezuela, Colombia, Brazil, New York. Well, New York's not a country, but you get where I'm going with it.
Yes,
Could be a whole country, right? So I think helping more people and really teaching more on what foods to eat, what exercise choices to do. There's so much general information, just do exercise, just do cardio, just do strength. But what are the actual exercises that help? And I think that's the biggest project that I have in the pipeline, is in terms of, hey, if you had a mastectomy, this is the great exercise to be doing. These are good chest exercises to be doing. You're going to feel comfortable with. It's not going to bring you pain or discomfort. These are great leg exercises for lymphedema, or after, let's say, colorectal cancer, right? This is how you can build up strength. So more specific niched exercise routines or programmings or exercises for patients with cancer, or people struggling with cancer.
I think that's awesome. People need this. We need people like you that are helping this population so specifically, because that's, you know, outside the box thinking that you need to have the education and experience on. So I think that's really amazing. Well, why don't you tell the audience where they can find more about your info?
Yeah, so we do have an Instagram page, and that's just OncolFit. So it's just onco, like oncologist, but the last is fit, like fitness, right? So OncolFit. So that's on Instagram. And then the website is oncolofit.com, where you can get all the blogs and breakdowns of what foods to eat. I have a grocery list of 67 items that kind of help with, that are shown to have cancer fighting properties. They don't cure cancer, but they do have those cancer fighting properties that make you feel better, reduce inflammation, that you can add to your nutrition, different exercise programs, different exercise plans, how to improve your sleep, right? All those things can be on the website as well for oncolofit.com.
I like that. And I really love your appropriate language where people don't get too caught up in it. It's like they don't kill the cancer, they've helped fight. It's always a matter of resilience in the body, because you have to be very careful with your language, because that's what people do when they try to trick you into things. And it's like, oh, this is going to kill the cancer. This will fix it. This will fix it all. It's like, no, we just try to become as resilient as we can. So I think that's good language. You can tell that you're a well-educated man. So thank you so much, JC. I am hoping to reach out with you in the future to hear how you continue to go down this path. I'm certain you'll have more stories for me. And I learned a lot today myself. So thank you so much for coming out today.
Thank you so much for your time. It's been a blast. I really appreciate it.
Thanks again to JC for that really cool story. Many cool stories about human resiliency. There's certainly some really good education in terms of just appreciating that how you work with these demographics is going to be based on the individual, based on the intensity that they can handle, and doing what they can at their own pace. But it's not, rewriting the book on health. It's still, what can you do for walking and fundamental cardio and strength training, and use your legs, do a push, do a pull. Like, the fundamental strength is still fundamental strength. It's going to be titrated based on the intensity that they can handle, making it so it's how hard can you go that day? And we're going to work around that. And to be able to have someone just come back from it as steadily as you can. And we did mention this, just like they're going through the battle of their life. The very first thing that you're going to want to do is go back to walking. And so if you're, know someone, or you are someone who's even just trying to get into training, walking is still the fundamentals, always the fundamental form of exercise and movement. But I think this whole episode was more about human resiliency. It was about hearing these stories of how hard people could push themselves. And a trainer is going to see that part of their life so much more. It totally makes sense to me when he explained it eventually, that the people who had the cardiac issues weren't necessarily in it to change their life. They're in it to get back to their old life. They're in it to do what they knew they should do, just to get back to fundamental health, kind of where they were. But it still doesn't confront them quite enough, as quite often people have multiple, heart attacks. Some people will change their life. Sometimes it wakes them up, but quite often it doesn't. However, as I mentioned, it can be them versus them. But when it's an individual versus cancer, they kind of separate themselves, possibly. This is my theory anyways. And it's you versus death, right? And you can fight for your life. And it was so cool to hear his stories, especially the older man who, once he realized it was about his grandkids, he could see his grandkids again. Now it's real. Now it's tangible. And that's what I think everyone should be thinking about. You should be thinking about your grandkids today, even if you don't have them. That is the best way for you to care about whether or not you live to 80, 85, or 90. Just think of your grandkids. Think of the life that will be there. Don't think of the number, because the number doesn't mean anything to you right now. It's so abstract. But your grandkids will mean something to you if you want to have grandkids. Your family, when you're around, when you're 80, 85, 90, that should matter to you. And it's a tangible thing that'll motivate you so much more. But to hear all these other stories of people who could push themselves so hard, the woman who had breast cancer 3 times and just wouldn't slow down, is incredible. I told JC, I hope he writes a book on this one day. I think he will have so many great stories. And I also said this to JC off air. I truly hope that he appreciates that it takes a unique kind of person to want to work and help with these people, because it's not an easy thing to do. It's not an easy thing to say, I want to work with people who are on, facing these edge of death's door, right? Like, you're facing something terrifying. I want to help those people, because the stakes are real fucking high. And for me, like, the stakes aren't crazy high if someone doesn't do their, fat loss goal. It's hopefully they do, but life or death is real, and it's scary and it's tough, but he does take passion in it. And I think that's a beautiful thing. So if you know someone, which, bear in mind, in this day and age, we all know someone who has had or may have ended up having cancer, and maybe they need an exercise physiologist to help them through it. Just don't hesitate to ask. And I would recommend you refer them to JC, as he has the in-person experience primarily. And now he's trying to touch more lives by doing it online. And I think we should help support that, because it is so impactful, as it does make people more resilient in the process of improving themselves during such a really hard time. So refer them over to JC if you know anyone. And thank you again for listening. I always appreciate you as a listener. If you can, please like and subscribe. The episode helps this little podcast grow. But remember, I just appreciate you as a listener no matter what. I appreciate you listening, giving me your time, and helping me help you in some way. So I'm always here to help that ambition, as you know. And it's not about the pursuit of happiness, my friend. It's the happiness within your pursuit. And I'll catch you next time.